Good day everyone. Today our topic eczema. Eczema is chronic inflammatory, non-contagious, non-infectious skin disease characterized by redness, swelling, scaling, vesicles and severe itching. The disease has a relapsing remitting course. The term eczema comes from the Greek word meaning to boil. It is called eczema because the small fluid-filled blisters on the skin look like bubbles when butter boils. Etiology and risk factors. Genetic predispositions or atopia, allergens, foods, drugs, chemicals, cosmetics, plant and animal-based substances, stress and emotional factors, and skin barrier dysfunction. Clinical features. Severe pruritus, erythema, edema, and vesicles and oozing, scales and fissures, and lichenification or skin thickening in chronic stage. Eczema may also develop in cases worm infestation, liver, gastrointestinal diseases, disorders of endocrine glands and metabolism, and as well as chronic infection foci, for example, sinusitis, tonsillitis, appendicitis, dental caries may contribute to the development of eczema. Eczema can occur at any age, from infants to the elderly. Most commonly, the exposed parts of the body, hands, face, feet, knee, elbow, wrist, are affected. Eczema has the following forms. True or idiopathic eczema. It is characterized by redness, vesicles, scaling, and crust formation and severe itching. The cause is unknown. Microbial eczema, it develops on the background of bacterial or fungal infections and located around the infected wounds and ulcers. And seborrheic eczema, it affects areas rich in sebaceous glands such as face, scalp, and chest. It presents with redness and greasy scales. Occupational eczema, it caused occupational eczema
by repeat.
It caused repeated exposure to irritants and allergens at the workplace, and the lesions appear the hands commonly affected. And
Infantile
or atopic eczema, it develops in infants and young children, and is usually associated with allergy. The skin becomes dry, inflamed and itchy. Contact eczema, it is caused after it develops after direct contact with allergenic and irritating substances, and the lesions appear at the site of contact. Varicose or stasis eczema, it appears due to chronic venous insufficiency and affects the lower legs and ankles. This hydrotic eczema, it characterized by small fluid-filled blisters and severe itching. The disease starts with erythema, then papules develop, the papules turn into vesicles, vesicles ruptures, and serious exudate appear on the skin, and in these areas stratum corneum peels off, and moist surface is visible. Then the exudate dries and forms yellow crusts. When crust is removed, the moist surface is visible. And after a few days, the inflammation calms down, oozing stops, crust forms, and skin heals. And but new flare-ups can happen. Subjective sensation in eczema includes burning, stinging, tension, and especially severe itching. The eczema lesions often are located symmetrically. And acute eczema lasts for several weeks. Then it either gets better or becomes chronic. Chronic eczema does not have redness and acute oozing, and the skin becomes dry, thick and scaly, hyperkeratosis, lichenification, and painful fissures may appear. But chronic eczema lasts for a long time, even years, decades, and it is disease that often comes back. I'm finished.